If you or someone close to you has diabetes, this conversation concerns you directly. Not to frighten you, but because there are things that matter to know in advance, before something happens. Diabetic retinopathy. This is the complication of diabetes that affects the eyes, and it's one of the leading causes of vision loss among working-age adults worldwide. Statistics show that the majority of people with type 1 diabetes and a significant portion of those with type 2 develop changes in their eyes over time. The most alarming thing about this condition isn't that it exists, it's that it produces no symptoms for a long time. A person sees normally, feels fine, while changes in the blood vessels of the retina are already underway. And by the time vision starts to decline, the process has already advanced considerably. Today, I'll explain what exactly happens to the eyes in diabetes, how to catch it in time, and most importantly, what can be done to protect your vision. To understand what's happening, we need to start with the retina. The retina is a thin layer of tissue at the back of the eye that captures light and sends images to the brain. It's essentially the screen of your vision, and it's threaded through with an enormous number of tiny blood vessels. In diabetes, blood sugar levels are elevated. When this continues for a long time, and with poorly controlled diabetes, this can go on for years, the walls of these small vessels gradually break down. They become fragile, lose elasticity, and begin leaking fluid where they shouldn't. In the early stages, tiny outpouchings called microaneurysms form in the retinal vessels. Then, the vessels start to leak. Fluid and proteins seep into the retinal tissue, causing swelling. Swelling in the central zone of the retina, the macula, is particularly dangerous. The macula is responsible for central vision, reading, recognizing faces, seeing fine detail. When the macula swells, central vision begins to deteriorate. In later stages, the body tries to compensate for the poor blood supply by growing new vessels. But these new vessels are abnormal. They're thin, fragile, and grow where they shouldn't. They can bleed inside the eye, cause scarring, pull on the retina, and ultimately lead to retinal detachment. This is a serious threat to vision. This is the core problem. Diabetic retinopathy in its early stages produces absolutely no symptoms. A person continues living normally, seeing clearly, while the changes are already happening. Symptoms appear later, and at that point, they signal that the process has gone far. Blurred or unclear vision that doesn't resolve. Dark spots or floaters in the visual field. Distortion of straight lines, where straight things appear wavy or bent. Sudden sharp vision loss, especially if bleeding has occurred inside the eye. Many patients come in for examination only when one of these symptoms has begun interfering with daily life. And that's lost time, because at earlier stages, there are significantly more options to help. Diabetic retinopathy doesn't develop in everyone and not immediately, but certain factors significantly raise the likelihood. The first and most important, duration of diabetes. The longer a person has lived with diabetes, the higher the risk. In people who have had diabetes for more than 20 years, the probability of developing retinopathy is very high, regardless of type. The second factor, blood sugar control. High glycated hemoglobin, chronic hyperglycemia. These directly damage retinal vessels. Conversely, good sugar control significantly reduces risk and slows progression. The third factor, blood pressure. Elevated pressure puts additional strain on already damaged vessels. The combination of diabetes and hypertension doubles the risk to the eyes. The fourth, cholesterol levels. High cholesterol worsens vascular changes and accelerates the buildup of deposits in the retina. The fifth, pregnancy. In women with diabetes, retinopathy can progress considerably faster during pregnancy. Ophthalmological examination during this period is especially important. Diabetic retinopathy is classified into stages. This isn't just medical terminology, it's information about what's happening and what can be done. Non-proliferative stage, early. At this point, microaneurysms, small hemorrhages, and initial vessel changes are visible. Vision is generally still unaffected. This is the best time to intervene. This is where the process can be stopped or significantly slowed. Pre-proliferative stage, intermediate. Changes are increasing. Retinal blood supply is worsening. Ischemic zones are appearing. Areas no longer receiving adequate blood flow. The risk of progression to the next stage is high. Proliferative stage, most severe. Abnormal new vessels appear. High risk of hemorrhage, scarring, retinal detachment. At this stage, treatment is more complex and outcomes are worse than in earlier stages. Diabetic macular edema can develop at any of these stages, and it's a separate threat to central vision that requires its own treatment approach. I feel fine, so my eyes must be okay. This is the most dangerous misconception. Retinopathy doesn't hurt. It produces no symptoms in early stages. Feeling well does not mean a healthy retina. I control my sugar, so retinopathy won't happen to me. Good control is very important, and it genuinely reduces risk, but it doesn't eliminate it entirely. Regular examinations are needed even with good control. My vision is normal, so I don't need to get checked. Normal vision in diabetes is not a guarantee of a healthy retina. Changes can be present while vision is still unaffected. A dilated fundus examination shows what you can never see or feel yourself. If it starts, surgery will fix it. Treatment at late stages is significantly more complex, more costly, and outcomes are worse. Vision already lost is in most cases not recovered. The goal is not to treat an advanced stage, it's to prevent reaching it. First and most important, controlling the underlying disease. Good management of blood sugar, blood pressure, and cholesterol is the single most effective thing a person with diabetes can do for their eyes. This isn't an ophthalmological recommendation. It's a medical fact confirmed by major research. Second, regular ophthalmological examinations. People with diabetes are advised to have a dilated fundus examination at least once a year. If changes are already present, more frequently, depending on stage. These examinations are what allow retinopathy to be caught early. Third, laser treatment. At certain stages, laser photocoagulation of the retina can stop or slow progression. The laser seals damaged vessels and ischemic zones, reducing the risk of abnormal new vessel growth. This doesn't restore lost vision, but it protects what remains. Fourth, intravitreal injections. For diabetic macular edema, specialized medications are injected directly into the eye cavity. They suppress abnormal vessel growth and reduce swelling. This sounds frightening, but the procedure is performed under local anesthesia and is well tolerated. Fifth, surgery. In late stages, with hemorrhage or retinal detachment, an operation may be required. This is a complex stage, but modern surgery achieves results that were impossible 20 years ago. If you have diabetes, you need to see an ophthalmologist not when something hurts or worsens, but regularly, on schedule, regardless of how you feel. First examination, immediately after being diagnosed with diabetes. This is the baseline. After that, at minimum once a year, see an ophthalmologist immediately if you experience sudden vision loss, dark spots or a curtain across your visual field, flashes of light, or distortion of objects. These are symptoms that cannot be delayed. Diabetic retinopathy is a serious complication, but it's not a sentence. With timely diagnosis and the right approach, most people with diabetes can preserve good vision for many years. The keyword here is timely. There is no need to fear this diagnosis, but you do need to know about it and act while there is still the opportunity to act effectively. If you have diabetes and haven't seen an ophthalmologist this year, that's your reason to come in. At Ko'z Nuri Clinic, we perform dilated fundus examinations, optical coherence tomography of the retina, and a complete assessment of the eye's vascular condition. After the examination, you'll know the state of your retina and what needs to be done next. Contact details and booking are in the description below.